Hello, hey there, beautiful mamas. Welcome back to the Balanced Mama Project Radio. I'm your host, Dr. Valerie Rucker-Bussey, neurologic physical therapist, pelvic floor expert, mama, and someone who believes deeply in honoring the body through every season of motherhood. Today, we're getting into a topic that is close to my heart and my core. I am a little cheesy in that way, but literally close to my core. It's how to move safely and powerfully through pregnancy and postpartum without fear or confusion or pain. Because I feel like we live in this culture that either says sit down and don't move, like freeze, don't move while you're pregnant, or bounce back, look flat, bounce back fast the second your baby is born. And neither of those things are realistic, and neither of those extremes are good for you. So, I am here today to walk you guys through three pillars of safe movement. And this is something that I teach every client inside the Balanced Mama Project. Myself, Dr. Saya, Dr. Lisa, we all teach these things throughout the Balanced Mama Project. And that is number one, pelvic floor awareness. Number two, breath first movement. And number three, a postural reset. So let's get into it. Number one, pelvic floor awareness. So your pelvic floor, it's a lot of times people think, oh, Kegels, 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 Kegels. And it's not just it's more than just one muscle for one. It's a group of muscles. Um, and it is not just something that you squeeze when you're trying to pee. It's the muscular base of your core. So you think of your core, it's not just the muscles on the front of your body, it's the muscles on the back of your body, it's the muscles on your hips. And you got to think there's a bottom part to that bowl, and that's your pelvic floor. Those are your muscles. Your pelvic floor muscles support so many things. They support your bladder, your uterus, your bowels, and it goes through it during pregnancy and birth. So, what I want you to take away from this is that you can start building awareness and connection with your pelvic floor right now. This again does not involve any Kegels. Okay. No fancy tools, at least no aggressive Kegels. Okay. We're just going to build awareness of our pelvic floor. So, I'm going to have you guys, those who are out there listening right now, I'm going to have you do this with me. I want you to either sit or lie down comfortably wherever you're most comfortable, right? And as you inhale, I want you to imagine your pelvic floor relaxing and expanding. So imagine the bottom of that bowl, the basin of that bowl, letting go, deepening, dropping down, expanding. Almost, I like to think of it like a balloon expanding. So we're going to inhale together and expand that balloon. A lot of times it takes some real concentration, real focus on truly releasing those muscles that sometimes we don't even realize we're gripping in the first place. And then on the exhale, we gently, very gently lift and engage that pelvic floor, almost like you are sometimes people say like you're sipping a smoothie through a straw. That's a little much for me, but like you're trying to stop the flow of urine, right? Okay, so the inhale is you relaxing and releasing, and then the exhale is that gentle, gentle lift. And so we want to, on a regular basis, be completely relaxed, right? We don't want to grip. We don't want that there to be muscle tension down there. That's what then starts to cause that incontinence that some people might experience. The muscles just too tight, too tense, too worked up down there. So, but we want to do this, bring this awareness so that we are uh, able to kind of coordinate that inhale, exhale, along with the relaxation and slight engagement with those pelvic floor muscles. And so that's just a tool. Your personal provider, and I want to be very clear about this, I'm not giving any prescriptions on this particular activity, because your personal provider is going to tell you how many of these you need to do. They're going to walk you through if you're engaging the right muscles or not. This is just a broad overview of, hey, there are some pelvic floor muscles down there, and this is how we can focus on them. Okay. So your breath to core pattern, that's actually what's going to be super foundational for having pain-free movement. And here's what I mean by that. So every movement that you make, so whether or not you're lifting a laundry basket or standing up or picking up your toddler, every single movement is an opportunity to either support or stress those tissues that are healing. So I'm going to say that one more time. Every movement that you make is an opportunity to either support or kind of stress those healing tissues. Okay, particularly postpartum, but this is something that you can train yourself in while you're pregnant. So we want to think about allowing, I love to think about this, is probably like the yoga instructor in me, but I love to think about breath leading the movement, right? So your golden rule is basically that you're going to exhale on the exertion. That's very, very key, because it's going to allow you to utilize your muscles in the best capacity, in their best shape and form. So if you're getting out of bed, for example, you're going to exhale as you push up, right? If you're lifting your baby, right, from the floor, you're going to exhale as you rise. Exhale on that effortful movement, that exertion, that's going to help you utilize your muscles a little bit better. It helps you to engage your deep, deep core muscles. It protects your pelvic floor muscles, because otherwise we're pushing down into that pelvic floor. And that's when people get all types of different things going on, like prolapse and things like that. And it supports healing. So especially if you've had a C-section or any sort of other complication in your delivery, that's going to be very, very key for you, is exhaling on the exertion. Okay, so we've brought awareness to our pelvic floor. We know what it feels like to relax that pelvic floor on the inhale and slightly engage it on the exhale. We are translating that into movement with the breath, right? And exhaling on the exertion. So now let's talk about a postural reset. This is interesting, right? Because during pregnancy, it's like, what is posture? All of your center of mass, where anyone is the heaviest, is usually in our core, in our midsection, because that's where our bulkier muscles, like our glutes and our, hamstrings, our thigh muscles, that's where those exist. In pregnancy, then we start to get pushed forward anteriorly, tipped forward, and our body has to adjust in posture. Sometimes we get this significant tilt in our pelvis that goes forward, and that's not great for our back or our core muscles, right? And then postpartum, a lot of it is inward, right? A lot of it is us kind of carrying our babies, maybe hovering over our babies, doing some feeding. We're going to talk to you guys about ergonomics, and that's something that we go through in depth in the Balanced Mama Project. But for right now, let's talk about a postural reset. Okay, so we want to learn how to realign our bodies, and it's very, very simple. This is something we talk to our clients about all the time. It's stacking your ribs over your hips, right? Stacking your ribs, your rib cage. So if you put your hands, find your rib cage, you're going to stack those ribs over your hips. If you slide your hands down, if they're on your rib cage, you should then immediately find your pelvis without having to kind of curve your hands forward or backwards, right? So ribs over hips, really, we want to think about it. If we're thinking about top down, we want to think about our ears over our shoulders over our hips. And then if we're standing up, we want to think about our hips being over our ankles or our heels, okay? And all of that is going to help us have wider shoulders, more expansion in our chest. Our crown is lifted. And that helps to just automatically, one, engage your core, engage those core muscles, uh, because remember, we're talking about our core being our whole midsection there, front, back, side, bottom, all of it, right? And it's going to help with our breath flow, getting a deeper, deeper breath. It's really hard to get a breath when we're here. It's also really hard to get a breath when we're super, super pushed forward into like kind of a sway back position. It's really hard to get a deep breath in either of those extremes. And this is also going to help the nervous system settle. Okay, so when posture is supported, healing accelerates. So here's what I want you to take from today. Your breath is a tool. Your posture is a foundation. Your pelvic floor is part of your power. So it's not something to be feared, your pelvic floor. When we move with intention instead of fear or force, we create a healing path that honors our bodies as they are right now, not as our bodies should be. And if this episode sparks something in you, if you're ready to stop guessing and start moving with confidence, I want to invite you to take the next step and join us inside the Balanced Mama Project. This is where the real transformation happens. So, not in isolation, not with a lot of random Google workouts or Instagram, TikTok workouts. No shade, no shade. But this is expert guidance from physical therapists, occupational therapists with doctorate degrees, right? Tai Chi specialists, yoga instructors, Reiki practitioners. We have a lot of experience and a wealth of knowledge to share with you guys. And the best part about it, I think, is the community. It's a community of moms who get it. And we have a really strong holistic approach to healing that actually works. So you can head to www.balancedmamaproject.com, or you can DM the word balanced on our Instagram, which is at balanced. That's BALANCED dot mama, MAMA dot project to get all the details. All right. So I will leave you all with this. Your body is wise. Your healing matters. And you are worthy of moving through this journey with strength, softness, and support. Stay balanced, mamas.